Of the 5,000 hospitals we have in the country, there are only 129 level 1 trauma centers. The 83% of those are at universities. You have to have every surgical specialist, every option for care available every day of the year around the clock. Very few institutions can bring to bear the resources to meet those needs outside of academic medical centers. There are a few. They're still teaching hospitals. There aren't any level 1 trauma centers that aren't associated with teaching hospitals.
Actually, the ratio that they recommend is 1 trauma center for every 1 million in population. So in the Houston metropolitan area, we have about 6 million people, and we only have 3 level 1 trauma centers. And so we were already short. So when UTMB had to close for a year, it put a lot of pressure on the 2 that remained, and both of them were in Houston, which is a fair distance from the refineries and from the oil rigs out in the Gulf and things like that. So it was, a hardship just trying to make sure that people could get triaged and get to where they needed to go in order to get the right level of care.
Hospitals are required to do a multitude of exercises within their facilities every year, and that contributes to response when something actually happens.
Well, the federal funding funds all of the residents. Without the residents, you couldn't provide the manpower 24/7. The federal funding subsidizes the medical schools. Without medical students, you don't have an academic endeavor to do the research, to have the science that's necessary, and to bring in multiple generations of people on an ongoing basis to fulfill the needs.
People don't really realize the value of a trauma center until disaster strikes. And so what happens for us is the teaching programs themselves. We use residents, we train fellows, we train burn doctors because we also have a blocker burn unit, and the Shriner Hospital for Children for Burn is right across the street from us. So we are kind of a combination that doesn't exist too many other places in the United States. So not to be able to train physicians so that we can continue to offer our programs as well as allow other people to start offering those services would be a huge gap in our fabric of how we provide service to people who really need it.
The critical role that trauma centers play is only recognized sporadically when we have major events. The truth of it is that there are 180,000 people who die in the United States every year from injuries. And without these trauma centers, that number would be astronomically higher, probably 50% higher.
Funding, particularly around emergency management, emergency preparedness in trauma centers, is invaluable. The funding is going down, but we still have these large responses. So we really need to figure out ways to increase funding and also use those funds very, very well, which I think we do well in Boston. And once again, all of that money just contributes directly to preparedness at the trauma centers. So it's very important.